CPX-351, or the liposomal cytarabine daunorubicin, is a liposomal form of the chemotherapy with a fixed molar ratio of 2:1 that in preclinical studies showed the maximum efficacy or killing of the leukemia cells. This drug had been developed in phase 1 and phase 2 clinical studies. And in those studies, we observed that patients that had therapy-related MDS or therapy-related AML or AML secondary from MDS had potentially a survival benefit in the phase 2. So there was a phase 3 designed with this medication, randomizing patients that had, again, either therapy-related AML or AML from antecedent MDS, or AML with dysplastic changes or karyotype similar to MDS. Those patients were randomized between what we consider the standard chemotherapy, what we call the 3+7, versus the CPX-351, with the primary endpoint of overall survival. The study in terms of efficacy showed that there was this overall survival advantage for those patients with the CPX-351. The response rates in terms of complete remission or complete remission plus complete count recovery, which we call CRI, were higher with the CPX-351. More patients were able to be bridged to allogeneic stem cell transplant. In terms of safety, the 30 and 60-day mortality with the CPX-351 was less than the intensive chemotherapy. So this led to the approval of the CPX-351 in patients we described, and that's what we currently use for patients with therapy-related AML. What's been presented at ASCO is subset analysis on those patients that had the therapy-related AML. So there's around 30 patients in each group that were therapy-related AML, and it really demonstrates the same overall results of the study in all the groups, that there was benefit of the CPX-351 in terms of efficacy compared to the 3+7 in that group of patients.